Hi, my name is Taylor Lacey, and my presentation is on tobacco use disorder. All right, in this presentation, I will be covering the epidemiology, cost and burden, and treatment aligned with tobacco use disorder. All right, first is the epidemiology. Tobacco use disorder is a diagnosis that is assigned to an individual who is dependent upon nicotine, which is found in tobacco products. The addictive nature of nicotine includes drug reinforced behavior, obsessive use, and recurrent use after abstaining from it, as well as physical dependence and tolerance. According to the DMSM 5, the Diagnostic Statistical Manual of Mental Disorder, a problematic pattern of tobacco use leading to clinically significant impairment or distress as manifested by at least two of the following occurring within a 12-month period: craving or a strong desire or urge to use resulting in a failure to fulfill major role obligations at work, school, or home. Tobacco use disorder is one of the most common substance use disorders in the United States. Abrupt cessation of tobacco use or reduction in amount of tobacco use followed within 24 hours by four or more of the following signs and symptoms, which are irritability, frustration, anger, anxiety, difficulty concentrating, increased appetite, restlessness, depressed mood, insomnia, weight gain, and cravings. Nicotine can also be administered through several routes, including inhalation, smoking cigarettes, cigars, or pipes, buccal, which is chewing tobacco, insufflation, which is snuff. There are different levels of tobacco use disorder, and they are based on which criteria is met. The first level is mild, which is a presence of 2 to 3 symptoms. Next is moderate, which is 4 to 5 symptoms. And lastly, severe, which is 6 or more symptoms. The cause. Tobacco use can lead to tobacco dependence and serious health problems. Smoking causes cancer, heart disease, stroke, stroke, lung disease, diabetes, chronic obstructive pulmonary disease, which includes emphysema and chronic bronchitis. When tobacco is used, the brain releases neurotransmitters such as dopamine, the feel-good chemical. Smoking also increases risk for tuberculosis, certain eye diseases, and problems of the immune system, including rheumatoid arthritis. Tobacco use leads to many more health complications such as lung cancer, heart disease, diabetes, chronic bronchitis, miscarriage, and pregnancy complications. Worldwide, tobacco use causes more than 7 million deaths per year. If changes are not made over the globe, more than 8 million people will die from diseases related to tobacco use by 2030. And this diagram pretty much is about current tobacco use by counties. The use of tobacco varies by geographic region within the United States. People living in certain regions and communities often suffer more from poor health because of tobacco use. All right, next is cost and burden. Tobacco use not only affects the individual who is using, but everyone in that individual's life. For anyone that uses any form of tobacco use is at great risk for being dependent. Studies show that individuals with depression or mental illness are more likely to smoke. As stated before, tobacco use can put an individual at greater risk for many diseases, such as cancer, heart disease, stroke, lung disease, diabetes, and chronic obstructive pulmonary disease, and etc. Treatment. There are effective treatments that support tobacco use, including both behavioral therapies and FDA-approved medications. Bupropion works by inhibiting the reuptake of the brain chemicals norepinephrine and dopamine, as well as stimulating their responses. Vorilicin helps reduce nicotine cravings by stimulating the alpha 4 beta 2 nicotinic receptor, but to a lesser degree than nicotine. They also boost the odds of successfully quitting and compare it with unassisted attempts. Nicotine replacement treatment provides a person nicotine without tobacco and the harmful chemicals in tobacco smoke. It replaces it to relieve the cravings and withdrawal symptoms. In addition, counseling could also help an individual learn to stop smoking and also provide individual support and encouragement. And lastly, social media platforms can also spread the cause and treatment options that could possibly decrease the use of tobacco. Therefore, it can attract people who are in the age range of 18 to 25 who also use social media often to spread awareness. In conclusion, this presentation addressed the epidemiology, cost and burden, and treatment that align with tobacco use disorder. Tobacco use disorder is the most common substance use disorder in the United States. Because of that, it is the largest and most preventable cause of mortality in the country. Tobacco use not only affects the individual who is using, but everyone in that individual's life. There are effective treatments such as behavioral therapies and medication that can prevent it. We can also enforce statewide tobacco interventions that include tobacco price increases, high impact, and anti tobacco mass media campaigns. And here are my references. And this is the end of my presentation. Thank you.